Hello, friends. Welcome to Akulmach Live. My name is Chandrakant. We all know that the virus has hit India pretty badly. The cases are on the rise, and for last 15 days, almost like 2 weeks or 3 weeks, the cases have been exponentially increasing. So we want to basically give a message in our discussion today, or rather discuss what more we can do to prevent the spread of the virus in India and also rest of the world. Before we start our discussion, a word on our giveaway. We have some unique Akulmach memorabilia which will make you look outstanding. The graphics on these corporate gifts are based on the global best business practices. To become recipient of one of these gifts for free, you have to watch this video till the end and provide your valuable comments. Or you can also share your experiences. The person who makes the best comment would be chosen to become a recipient of this beautiful Akulmach gift, absolutely free, delivered to your doorsteps. The winner would also get a chance to be invited live as a distinguished panelist during our next video. What are you waiting for, friends? Please subscribe Akulmach and smash that like button. Now let's get back to our discussion. Friends, let me welcome my guest today. His name is Mr. Neville Gaunt. He is the chairman of Mindfit Limited and he joins us from London. So, without further ado, let me invite Neville to the show.
Good morning, CK. Good morning, everybody. It's a bright sunny day in London, and hopefully, we are moving into an unlocked arena. But as this is a nasty virus, COVID virus, that travels around the world at some lightning speed, let's bring yourself up to date with what's actually happening in India, CK.
Well, Neville, as you know, that virus is increasing exponentially. Even though there has been a slight dip between yesterday and today, but still it is moving ahead. And the doctors are saying that it will peak after it will continue to increase. Number of cases will continue to rise, and it will peak after 3 weeks from now. So we have not yet seen the peak of the virus of the second wave, expected to be in May third week or fourth week. And this time, a lot of young people are infected. A lot of young people, even though they must be carrying it, but because of the young people getting infected, there are a lot of pressure on the health services in India. There are not enough beds. In fact, today morning there was a news that in one of the states they've run out of ICU beds. So army has come in to help. They are actually building their makeshift ICU with 1,000 beds in different parts of India. What we hear from in the news is that it's the 85% patients are coming from 10 states. So still it is contained in some way. Prime Minister has come and appealed to the nation that they should stay indoor. They should follow all the protocol that has been laid, which is wearing a mask. In fact, now they are saying that you have to wear double mask, and every 5 to 10 minutes, keep cleaning your hands. Best thing is wash your hands and your face with soap. But if you are not able to do that, at least carry a sanitizer and sanitize your hands. So this is what is going on. Between yesterday and today, the count, as per the news, was 325,000 people, new COVID patient in last 24 hours.
I mean, that's a huge number of people. I mean, you just can't imagine it, really. Although India is a huge country, 1.4 billion people, and in some respects these are large numbers, but in the whole scheme of things, they're still quite small numbers. The key issue that we've got to address, though, is our own behaviour. I mean, this is where we can individually do as much as we can do. We can take the advice from Prime Minister, from the government, from the politicians. We can also see what these politicians are doing because it's very transparent. But one of the last things we should be doing is going on the streets and complaining that there's lack of oxygen or the hospitals can't count, because actually you're complaining against something and you're demonstrating that you're just adding to the problem. So we need to be smart. I mean, I will talk about having a can-do attitude, as I will always revert to. And if you're continually moaning and demonstrating in the streets about the lack of oxygen or the lack of opportunity, then the likelihood is you're in a can't or a won't do mode. And particularly when it comes to COVID, you are doing the very thing that you shouldn't be doing. So you need to get yourself into a can do mode. If you really feel as though you want to demonstrate, you can't catch COVID from a tweet. You can't catch COVID from an Instagram post or a LinkedIn post or a Facebook rant or rave. No, go on there if this is what you want to do and make your voice heard. But what can you do? Let's look at the real practical arena of what you can do for yourself and the safety of your family. And interestingly enough, CK, we're going to be saying everything that was said at the very beginning and has been said continuously all the way through. And in fact, when you started your comments today, you've said it as well. Double masking, stay at home, look at your own social behavior, use sanitizer all the time. These are just the simple things we can do. But quite clearly, there are some people that aren't doing it. And because you've got some people that aren't doing it, everyone is now put at risk. So let's just go over those very simple things that people can do for their own family. You're the head of your family, CK. I know you live with your parents, so you've got some elderly relations with you. You've got young children. Let's demonstrate what you do as a family to help protect yourself.
Well, Neville, I think the first thing is that we have to not get the virus. I think that's the first worry most of us have. And so far, it has been proven that social distancing is the best cure. And even if you get the virus, there is no cure. I mean, even if you're vaccinated, it is going to only protect the lower part of the lung. The upper part of the nasal cavity is still exposed to the virus. So even vaccination is not 100% cure. There is no cure. So the best thing to do is not to get it in the first place. And how you will not get it? To answer your question, Neville, I think we don't want to get out of the house now. I made very strong rules yesterday for the family that all the servants will be let off. There'll be no one coming in, and if there is some delivery guy coming in, he will not even enter from the main gate, which is outside the house, and we will have to go and pick it up ourselves. We have to go down 2 floors or 3 floors, pick it up ourselves, sanitize all the stuff outside the house in the porch area, and then bring it inside. So these are very strong rules I have set up for everyone, including my parents, and I am going to adhere to it, and I'm going to overlook all these things, because the worst thing that can happen is we get infected with the virus. I think that is for sure. We have to protect ourselves. The second thing is we have to maintain our social life. So I think there is enough tools available. There is digital media being available. You and I are talking 6,000 miles apart. So we'll continue to do that. We'll continue to maintain our social relationship. But I think we have to completely isolate ourselves and, head on, not to take this second wave head on, but to hide behind it, not to get exposed to the virus at any cost.
I think that's the most important message people can be given. But the interesting thing is, this message has been given time and time and time again. And the fact of life is that there aren't enough people making the change in behavior, because this is a change in behavior. It's something that we didn't do previously. I mean, I didn't see anyone wearing a mask in the UK. not even people that had bad asthma in highly densely polluted arenas. I would see some cyclists, interesting enough, wearing face masks, protectors, and ear defenders if they've gone onto a building site, and eye protection if you go onto a building site. So the term PPE, if you're in construction, actually is a normal term. It's what everybody has to have if you go on a building site. You have to wear a hard hat. You have to wear protective boots. You have to be highly visible to other people. In certain parts of the arena, you have to wear gloves. You have to wear eye protection when you're working with tools and materials. And you have to have what they call ear defenders. And that could be something like this that's stuck over both ears, or it could just be earplugs that you get when you travel on an airline. So these things are common nature in the construction industry. And now what they need to be is common arena in our own homes. This is not scaremongering. It's been said by so many people so many times. But for your protection, your household's protection, prevention is far better than cure. And the weakest link to our protection is us. If we don't think, if we haven't got a can-do attitude, and we do the things that we need to do to protect ourselves, then the only person we can actually blame is ourselves. And that's not an easy message to give or receive in many respects, but the facts of life is we've been told time and time and time again that the only protection here is social distancing, wear a mask, have personal hygiene, and literally don't spread the virus. If you get the virus, isolate yourself. So the message today is really very, very simple. It's with the backdrop of an increasing problem in India. As your own government has said, the peak will happen in 3 weeks' time. Well, there's over 250, 300,000 people a day being infected. What will the peak look like? 1 million? 2 million? I mean, who knows? If you look at the trajectory of the UK graph over the last year, because we're just about a year and a month after the first lockdown, and we saw a graph that looks a little bit like the map behind me. It went up exponentially, and then over the summer months it came down. And that was because we had a lockdown. And then during the summer months, we knew it was starting to move up again, but we didn't lock down until October. And when we did lock down, it still started to increase. And then we had the festivals, the religious festivals, and it still started to increase. And it's only just coming down now. So what we've had is an uptake, it's come down, and it went up even higher. And now it's coming down again. But it's not disappearing, unfortunately. This is a way of life, and we need to get used to it. Someone said to me literally yesterday was, do you think we'll be not wearing masks by the end of the year? And I said, which year are you talking about? And that's the way I see it currently. I'm going to protect myself, not because I'm getting older, just because I'd like to be around, and I will protect myself and prevent catching the virus as much as possible. I'll do what I can do. And now what we've all got to do is exactly what each of us can do. Simple message, but now's the time to really listen to it and take it home.
Neville, I just like to add few things from my side also. In my family, everyone has been vaccinated except the kids. The first jab we got, but I think we should not be going to the hospital to get the second jab, even though it is available. I'm thinking, and I'm going to decide and discuss within the family that we will probably go in June, because we got the first jab already. There is not much risk, but if we go to hospital, there is a lot of risk. There is a chance that we may get the the disease. There are other developments are being tried by the scientists here in India. They are actually doing a lot of research on the nasal vaccination, um, and that is expected to come out in June. It'll be like a polio drug, drop two drops here and two drops here in both the nostrils, and then you're covered. So you got the vaccine, you got the nasal vaccination, and that will be much better protection. And then you'll be completely protected, because if your nasal cavities are also protected by vaccination, then the chance of virus entering any mutation of virus is very, very low. So I think till the time this whole thing comes out, we need to have patience. We do not go to the hospital and flood the hospital by human traffic, because there is lack of facilities there, and there are enough patients, uh, and there are less doctors. We cannot increase the number of doctors overnight. It will take time. So I think the first thing is to understand where we are, and understanding, for especially for everyone across the world, and more so for Indians, is to stay indoors. Move your work on the digital platforms and work from home. Don't go around socializing with people, because that is where you drop your guard. Don't go to hospital unnecessarily until unless you have to. For simplest reason, there is no there is for a common common thing, you should not be going to the hospital, or you should not panic and go to the hospital. So I think that is something that we need to do. We have not to panic, we have to have patience, we have to maintain social distancing, and also keep washing our hands every 5 to 10 minutes. I think that is a best practice that we all must follow. From my side, Neville, this is what I wanted to add.
Yeah, and it's important. And one other thing it's really important to state is that even if you've had both vaccinations, like I've had, it is not a complete prevention. I can still catch the virus. That's been made very clear by all the medical profession, certainly in the UK, and if not around the world. Um, but that means to say, take the vaccination, and it will give you an element of protection. And all that means is that if I catch the virus, God forbid I ever do catch the virus, my immune system at least will be able to fight it that much easier. And that's the purpose of the vaccination. It will not stop you catching the virus. We need to make that perfectly clear with everybody here. It's just another part of our armory that's help us going to fight it. It's a bit of a solemn message today because lots of people are struggling around the world, and we see various variants of this virus being mutated because it's a very smart virus. It's a bit like cybersecurity. No, cybersecurity and COVID have one thing in common. They both start with the letter C. And for those people that have heard us before, the letter C is the only one we focus on in a business context. But cybersecurity and COVID have another thing in common. Humans are the weakest link, but also they're the strongest link. So now, if you're a business person out there, you can actually see that there's a huge correlation between protecting your business from cybersecurity and protecting yourself from the COVID bug. So that's just the message today. It's a little bit solemn, to say the very least. CK and I have lost good friends, and my other friends around the world have lost family members. And it's not a nice thing to have to happen when you're taken from the earth a little earlier than someone had planned for you. But the fact is, this is a fact of life, and it's a wake up and a reminder to us all that we are all quite fragile. But we can do things to make ourselves a little bit more solid. We can put that armor on and protect ourselves better. And in this case, it's quite simple. The message has been very clear from the very start. Wash your hands, socially distance, and wear a mask. And that's how we're going to finish today. Thanks very much, CK, for chatting with me on a beautiful sunny day. So let's enjoy the sun, look up to the sunshine, and have a smile on your face.
Absolutely, Neville. Thank you so much for finding time and discussing this very, very important issue, which affects everyone globally. But I will catch up with you tomorrow again on something more interesting.
Cheerio, CK. Have a good day, everybody.